Hi, my name is Ravneet Dhaliwal. I am a master's student from Pacific University. I am presenting our research in collaboration with my advisor, Dr. Jane Tram, titled Examining BIPOC Student Responsibilities in Higher Education. Before we get started, although many of us are aware of this acronym, BIPOC stands for Black, Indigenous, and People of Color. The student population in the US is becoming more diverse each year. For example, in 1996, BIPOC students comprised 29.6% of the undergraduate student population. This number has since increased to 45.2% as of 2016. Similarly, the BIPOC student population in graduate programs has increased. Institutions and academic programs are not structured to accommodate the experiences, needs, and expectations of BIPOC students. Research with BIPOC students is important in order to address the barriers and challenges that exist. In this study, we focused on highlighting and understanding BIPOC student roles and responsibilities. BIPOC students hold various additional responsibilities in addition to their academic and professional responsibilities. Cultural context can have an important role in this domain because in BIPOC communities, it is more normative to be providing high levels of care for family members. Our study focused on the domain of personal care. Personal care is described as providing care to another individual that is essential and critical to that individual's well-being, health, and safety. Some examples of what this could include would be providing medication, administering medication, bathing, dressing, or washroom assistance. We focused on the level of personal care students provide to immediate family members. For this study, immediate family is defined as family members such as a spouse, partner, or biological step, foster, or adopted children. The question we examined was, is there a significant difference between BIPOC and white students in the amount of personal care they provide for immediate family members? We measured this based on reported hours spent per year providing personal care to immediate family. We created a Qualtrics survey and recruited and disseminated the survey via Prolific. The participant sample of 357 includes students in higher education, both undergraduate and graduate programs across the USA. In this chart, you can see the breakdown of ethnicities. The sample was comprised of 52.1% white students and 47.9% BIPOC students. We found a significant difference between student reported hours in this realm. More specifically, BIPOC students reported a significantly higher number of hours compared to white students. As you can see in the second chart, BIPOC students had an average of 236.6 hours spent providing personal care to immediate family, whereas white students had an average of 79.3 hours. Thus, BIPOC students are spending a greater amount of time providing high levels of personal care to their immediate family, and this is in addition to their academic responsibilities. This finding highlights one domain of additional responsibilities that BIPOC students may have. Our data suggests that BIPOC students have a higher responsibility in this domain than their white peers. This finding highlights a difference between BIPOC and white students that extends beyond the academic context. This insight allows us to better understand the context of BIPOC students and how it may be impacting their academic experience, satisfaction, and attrition. Ideally, this understanding should translate into action and change that will help us better support BIPOC students in higher education. Two limitations of this study were the survey length and the metric used to measure personal care. Future research can examine the domains of care on a shorter time span, such as weekly or monthly. Lastly, future research could expand the domains of care to include other realms as well. Thank you.